Hi, this is Kelly Fellmeth, and I'm going to be doing my head to neck physical assessment today. First, I wanted to go over some of the supplies that I have that are mainly on a tray here next to me. First and foremost, I do have my stethoscope around my neck. My stethoscope does have the diaphragm and the bell. Next, I have my Snellen eye chart. I also have gloves, alcohol swabs, and hand sanitizer. Behind the camera, there is also a sink that I'll be using to wash my hands. Next, I have this pen, which I will be using as my tongue depressor, and a pen light. I also have a cotton ball, toothpicks, a cup with a scent in it, this screwdriver, which I'll be using as my tuning fork, and this small flashlight, which I'll be using as my otoscope. I will now begin my head to neck physical assessment. Oh, good morning, Mr. Timberlake. How are you today? Good, I'm glad to hear it. My name is Kelly. I'll be taking care of you today. How was your drive getting in? Yeah, the traffic has been really light. It's been very enjoyable, I agree. Yeah, the weather seems really nice today, too. Hopefully we can get some time outside later, right? Yeah. So as you know, today we're going to be doing your head to neck physical assessment. If you have any questions, comments, concerns about anything that we go over today, please feel free to let me know. I'm going to be giving you some instructions during this assessment. If at any point you need me to repeat those instructions or you need me to slow down, again, please feel free to let me know. Before we really begin this assessment, I'm just going to go wash my hands. I'll be right back. Okay, so first and foremost today, when you came in here, I noticed as you were walking and getting up on the table, your gait appeared very steady. You didn't seem to be off balance. I know you do a lot of dancing, so that's very normal, right? Yes. Also, I noticed that your outfit is appropriate for the spring weather, and I haven't noticed any malodor coming from you. When I asked you how you were, you seemed to be in a very pleasant mood. I am inferring that you can understand me and you can hear me by your responses. Yes, great. And also I noticed that your skin is a very pink, natural color, which is normal for you, so that's also good. Okay, we are now going to inspect your head, your cranium, your scalp, and your hair. Before I begin this part, I'm going to put on some gloves. Have you noticed anything wrong with your scalp or your hair? Any changes? No? Okay, good. I'm first going to inspect your scalp, hair, and cranium, and then I'm going to palpate these areas. So first I'm just starting off, I'm just looking at your head. I'm looking for any areas of deformity. I'm seeing that everything is symmetric and looking normal. Good. The next thing I'm going to do is I'm just going to part your hair in several areas. I'm just going to look at your scalp. Basically, right now I'm looking for any excessive dandruff or any lesions, anything that wouldn't be considered normal. So I'm just going to part your hair. Good, everything is looking good. Have you experienced any dandruff? A little? Okay. The next thing I'm going to do is I'm just going to palpate your scalp. So you're just going to feel my fingers moving over your head. Here I'm feeling for any deformities, any areas of tenderness, any lumps. If at any time I hit a spot that's uncomfortable, that it doesn't feel good, please let me know. Okay? Good. All right, I'm just starting the back of your scalp here, coming forward. Good. I'm also feeling your hair too. Good. I did not feel any areas of deformity. You reported no areas of tenderness. I didn't feel any lumps. I didn't see any lesions, and your hair feels to be of a fine texture. which is all normal for you. Good. Any questions with those findings? No? Okay. I'm right now just going to use some hand sanitizer and change my gloves. 1 minute. Okay. The next thing I'm going to do is I'm going to test cranial nerve 7, which is your facial nerve. To do cranial nerve 7, I'm just going to be asking you to make some facial expressions. Are you okay with that? Okay, good. So first, can you smile for me? That's a beautiful smile, Mr. Timberlake. Good. Okay, now can we frown? Turn that frown upside down, right? Okay, and now we're going to grimace. Good. So I noticed that your smile, your frown, your grimace was all symmetrical, no abnormalities with that. So I'm going to document that cranial nerve 7, the facial nerve, is intact and normal. Good. I'm now going to feel for your TMJ joint. To do this, I'm going to be placing my hands right in front of your ears, right in front of the tragus area. And then I'm going to ask you to open and close your mouth, okay? Okay, good. So I'm just going to place my hands right here, right in front of your tragus. Good. Now open your mouth, please. Good. And close. Good. So during that, I was feeling the strength of your jaw, which seems to be normal. I didn't feel any tics or, and everything was moving smoothly and symmetrically. Again, no abnormalities. So, and I'm noting a full range of motion with that in your jaw, which is great. Any questions with that? Good. I'm now going to use hand sanitizer again and change my gloves once more. Next, I'm going to test cranial nerve 5, which is your trigeminal nerve. To do this, I'm going to be touching your face with an item that is of a sharper point and then an item that is softer. It's not too sharp, so don't worry about that. I'm going to ask you to close your eyes, and when I touch your face, you're going to tell me either sharp or soft. I'm going to demonstrate first these two sensations on your hand so you know what to expect. All right, can I have you close your eyes? Okay, so let's just first test these on your hand. That's the first feeling, and the second one. Good? Okay. I'm now going to have you, again, close your eyes and make sure you keep your head forward and still. Ready? Okay. Good. Sharp. Soft. Good. Good. Great. So you were able to identify all the sensations. So I'm noting that cranial nerve 5 is intact and normal. Perfect. We're now going to move on to the test cranial nerve 11, which is a spinal accessory nerve. To do this, I'm going to be testing the strength of your cervical spine. I'm going to be placing my hand against your cheek, and then I'm going to ask you to turn your head towards my hand. And you're going to feel a little bit of resistance, but I just want you to push against that. Does that sound good? Okay, good. And then we're going to do the same thing to the other side. Okay? Perfect. All right, so I'm just going to place my hand here on your cheek. If you could turn your head. Good. Now we're going to do the other side. Good. So I'm testing here that your strength is normal. You were able to push against my hand, which is great. So I'm going to document that cranial nerve 11, which is the spinal accessory nerve, is normal and intact, which is great. Do you have any questions so far about the exam? No? Okay, before we move on to your eyes, I'm just going to clean my hands once more, and I'm going to change my gloves again. Okay. Ready to move on to the eyes, Mr. Timberlake? Good. So for now, to assess your eyes, I'm going to inspect your eyes for symmetry. I'm also going to be looking at and palpating your upper and lower eyelids, just looking for any exudate, any abnormal discharge, again, any tenderness or masses. I'm going to also be looking at your conjunctiva and your sclera and the iris for color. Please let me know if you experience any discomfort at any time or if anything is tender or painful. Are you ready? Okay. Right now, I'm just looking at your eyes. They appear to be symmetric. Good. I'm now going to palpate your upper and lower eyelids. So I'm just going to place my hands right here. Good. No areas of tenderness. Great. I'm not seeing any extra discharge or any abnormal masses. Again, you reported no tenderness. I also noted that your conjunctiva is white and normal. You have a nice blue eyes, and your sclera is also of normal color. All right, everything looks good with there. I'm now going to do the Snellen eye chart exam. Have you done this? It's when you cover your eye and read the letters. You have done this before? Okay, great. So just so we remember, we're going to be standing about 20 feet away from the chart. I'm going to ask you to cover one eye at a time. Do you wear glasses or contacts? You don't? Okay. So if you did wear contacts or glasses, I would ask you to keep them on during this exam. So like I said before, we're going to cover one eye, and you are going to read off to me the lowest line that you can see. Sound good? Okay. Here's our chart. We're going to back up 20 feet away. All right, Mr. Timberlake, can you please read the lowest line to me that you can see? All right, good, Mr. Timberlake. Can you now cover your other eye, please, and do the same thing? Good. Perfect. I'm going to note that you have 20/20 vision in both of your eyes, and that is also unaided, meaning you weren't wearing any glasses or contacts, which is perfect. I'm now going to test for cranial nerve 2, which is the optic nerve. To do this, I'm going to perform the fishbowl test. So basically, I'm going to be standing behind you, and I'm going to be moving my hands around your face. When you see my fingers off to the side of your eyes, I want you to let me know, okay? Any questions with that? Okay, good. So again, I'm going to stand behind you, and when you see my fingers off the side to your peripheral vision, you let me know. Okay. Here? Good. Here? Good. Good. You were able to see my fingers in a normal peripheral view, so I'm going to document that cranial nerve 2, which is our optic nerve, is intact and normal. We're now going to move on to cranial nerves 3, 4, and 6. 3 is our ocular motor nerve, 4 is our trochlear nerve, and 6 is the abducens nerve. So to do this, I'm going to ask you to keep your head still, and you are going to follow my pen light with just your eyes. Again, remember, we're not moving our head like this. Head is nice and still, looking forward, and just moving your eyes to where my pen light is. Does that sound good? Okay, let's do this. Here is my pen light. Again, look straight ahead at me, and we're going to follow my pen light with your eyes. Ready? Good. Good. Perfect. So during that exam, I noticed that you didn't have any jerking of your eyes. Your eyes weren't going back and forth. It was a nice, smooth, symmetric movement. So I'm going to document that cranial nerves 3, 4, and 6 are intact and normal, which is great. Any questions so far with the exam, Mr. Timberlake? No? Okay, you're doing great. We're now going to test your pupillary reaction. So basically with this test, I'm going to just be shining my pen light through the side of your eyes, and I'm going to be examining the reaction of your pupils. This is going to also test cranial nerve 2, which is our optic nerve, and cranial nerve 3, which is our ocular motor nerve. I'm just going to ask you to look straight ahead at me again, and I'm going to be using my pen light like I said before. Okay, so I'm just looking into your eyes. Good. I'm now doing the other eye. Perfect. So during that, I noted that your pupils are round, they're equal, they're reactive to light, which is all normal things. So I'm again going to be documenting that cranial nerve, 2 and 3 are intact and normal. Okay, we are now going to move on to your ears. But before I do this, I'm again going to clean my hands with my hand sanitizer and don new gloves. I'll be right back. Okay. So first for your ears, again, we're going to be following the same format that I've been doing for the last part of the assessment. I'm first going to inspect, and then I'm going to palpate. So I'm just going to be looking at your ears. I see that they're placed in a normal position. One ear is not higher than the other. They're symmetric. Okay, good. Have you noticed any problems with your hearing or anything? No, you haven't? Okay, great. I'm now going to palpate your ears. I'm just, feeling for anything abnormal. Again, the normal, tenderness. Please let me know if anything is discomforting, and just any masses or lumps that shouldn't be there. Okay, I'm just feeling your ears. Good, everything seems to be normal with that. So since you reported nothing wrong with your hearing, which is great, but we're just going to do a few tests that basically test how your hearing is. So we're now going to do the whisper, the Weber, and the Rhine test. And all these tests test the function, all these exams test the function of cranial nerve 8, which is the vestibulo-ocular nerve. I know, that's a hard word to say, right? All right, so now I'm going to do the whisper test. To do this, I'm going to be standing about 2 feet behind you. And I'm going to whisper words into your ear. And let's say I'm whispering a word into your right ear. You're going to be occluding your left ear, okay? I'm going to whisper 3 simple letters, and I'm just going to have you repeat back what I whispered into your ear. Does that make sense? Okay, good. We'll then switch and do the opposite ear. I'll whisper in your left ear, and you'll occlude the right. Ready? Okay. I'm just going to come and stand behind you. All right. Can you occlude your left ear, Mr. Timberlake? Perfect. All right, just repeat the 3 letters that I'm about to whisper, if you can hear them. K, B, C. Good, Mr. Timberlake. Now can you occlude the opposite side? I'm going to whisper within your left ear. H, F, T. Good, Mr. Timberlake. You were able to hear each letter, and you were able to repeat what I said, which is great. From that test, I see no signs of hearing loss, which, like you reported, you're not having any issues with that. So we're now going to do the Weber test. So with the Weber test, I'm going to be placing an item called a tuning fork on the top of your head. And the tuning fork vibrates, and you're going to be able to hear the vibration noises. You should be able to hear them on both sides of your ear. If you don't, obviously, please let me know. And are we ready for that test? Okay, so I'm just going to hit my tuning fork here. It's going to go on the top of your head. Do you hear the sound equally and laterally on both sides? Good, great. So I'm going to note that you had a normal Weber test, which is awesome. All right, and now we're going to do the Rhine test. So the Rhine test, I'm also going to be using my tuning fork. I'm going to first hit it to make it vibrate. I'm going to place it on your mastoid bone, which is right behind your ear here, and you're going to tell me when you stop hearing, when you stop feeling the vibration. After you stop feeling that vibration, I'm going to move my tuning fork right in front of your ear. You should then be able to hear that vibration noise. Again, you're going to tell me when you stop hearing that vibration noise. So I'm going to hit my tuning fork. It's going to go on your mastoid bone. You're going to tell me when you stop feeling that vibration. Then we're going to move it out here, and you're going to tell me when you stop hearing that. Sound good? Great. I'm going to be using the timer on my Apple Watch to conduct this assessment. Are we ready? Okay. I'm going to hit this right on your mastoid bone, and good. You tell me when you stop feeling it. Now? Okay. You tell me when you stop hearing it now. Done? Good. So you were able to feel the tuning fork on your mastoid bone for about 10 seconds, and then you were able to hear it for about 20 seconds, which is normal because air conduction is greater than bone conduction. So I'm going to document a normal Rhine test, and again, because you had a normal whisper test, a normal Weber test, and a normal Rhine test, I'm going to document that cranial nerve 8 is intact and normal, which is perfect. Now, the last part of our ear exam, I'm going to be using my otoscope to examine your ear. I'm going to ask you to keep your head forward and to not turn your head at any time, okay? I'm just going to be looking at your tympanic membrane and inside your ear, making sure everything is normal. If, again, you feel a point of any pain, tenderness, please let me know and I will stop this part of the exam. Any questions? Okay. I'm using my otoscope here. I'm going to be pointing the light towards the ground and I kind of hold it like a pencil. I'm going to be propping my hand up on your cheek just to steady my hand and make sure that I'm not putting the otoscope in farther than it needs to go. Okay? All right, I'm just looking in your ear. Hand is propped up on your cheek. Good. All right, I'm now going to do the other side. Good. I saw that your tympanic membrane is a pearly gray color, which is normal. I didn't see any excessive earwax, which is also great. Okay. We are now going to move on to the nose and sinus part of our exam. But before we do this, I'm going to, again, wash my hands and I'm going to change my gloves. Okay. Have you experienced any issues with your nose lately? Any decrease in scent or anything? No? Okay, good. So the first part, again, I'm just going to start with inspection. I'm going to just look at your nose and look for symmetry, make sure there is no deviation to the left or right. I am then going to palpate your nose, just feel, make sure everything seems normal there, okay? So I'm just looking at your nose. Good. I'm now going to also use my pen light to look into your nostrils. Good. Good. I I am now going to just palpate your nose, just feeling down the bridge of your nose to your nares. Good. Perfect. Now we are going to be testing cranial nerve 1, which is the olfactory nerve. To do this, I'm going to have you close your eyes, and I'm going to be putting a scent under your nose. And all you need to do is just identify that scent. I will tell you that it's a very common scent, and it should be one to be easily identified if you're able to correctly smell it. Sound good? Okay. I'm going to now have you close your eyes. Okay. And can you smell this for me? Vanilla. Perfect. Right. You can open your eyes now. Good. So I'm going to document that cranial nerve 1 is intact and normal. So now what we're going to do is we're going to palpate your sinuses, okay, for any tenderness. Typically, you can't really feel your sinuses unless you have a cold or a sinus infection. So right now, we shouldn't have any areas of tenderness, but again, if you do experience that, as always, please let me know. Good? Okay, so I'm just going to be placing my thumbs right here under your eyes. Good. All right, I'm now going to do your upper frontal sinuses. Good. So no tenderness, right? No pain with that? Perfect. So I'm going to document no tenderness within your frontal sinuses. Perfect. All right. We're now going to move on to the mouth and throat portion of our exam. Again, like always, before we do this, I'm going to change my gloves and clean my hands. Okay. Have you experienced any problems with your mouth? Any sores that aren't seeming to go away? Anything like that? Few ulcers now and then? Those are normal, right? Typically after like you bite your lip or something. Yeah. Okay. So pretty much normal, right? Okay. So for this, I'm going to be using my pen light again. I'm just going to have you open your mouth, and I'm going to be looking on the inside of your mouth. I'm going to be looking at your hard and soft palate, underneath your tongue, your cheeks, pharynx, your uvula, anything like that. Also, I forgot to mention, have you had any problems with your teeth? Any sensitivity or anything? No, and you see the dentist regularly? Good, perfect. All right, so before you open your mouth, I'm just looking at your lips right now. They seem smooth, not dry, no cracks. Good, now can I have you open your mouth? Good. I'm just looking in the inside of your mouth. Can you lift up your tongue? Good. Looking at your cheeks, palate there. Perfect. Everything seems normal. So we're now going to look at cranial nerve 12, which is the hypoglossal nerve, okay? So to test the function of cranial nerve 12, I'm going to ask you to stick out your tongue, okay? Basically what I'm looking for is to see that there's no deviation within your tongue, okay? So can you stick out your tongue for me? Good, perfect. So no deviation, which is normal. So I'm going to document that cranial nerve 12 is intact and normal, which is great. All right, so now we're going to test cranial nerve 9, which is the glossopharyngeal nerve. So to test this nerve, I'm going to use my pen light to look in the back of your throat. And I'm going to ask you to say, ah, okay? All right, can you open your mouth again? Good, now can I have you say, ah? Perfect. So during that test, I noticed that your uvula did rise and fall, which is normal. I also took note of your tonsil sizes, which is a 2+, which again is also normal. So I'm going to document that cranial nerve 9 is intact and normal. All right, the next thing that we are going to test is cranial nerve 10, which is our vagus nerve. So with this is our reflex nerve, okay? So I'm going to be using a tongue depressor, and I'm just going to lightly put it in the back of your throat. Don't worry, we're not going to be, gagging or anything. I'm just looking for a reaction, okay? Any questions with that? No? Okay. So here's my pen light. Can you open your mouth again? All right, just stick this back here. Oh, okay, good. So we were able to elicit a small gag reflex, which is great. So I'm going to document that cranial nerve 10 is intact and normal. All right, Mr. Timberlake, so far we've been over a lot of things. Do you have any questions with anything? No? Okay, good. So for the last part of our exam, we're going to be going over our neck area, okay? Before we do this again, I'm going to clean my hands and put new gloves on. Okay, let's get ready for the assessment of our neck. So first, I'm just going to inspect your neck just like we have done. I'm just looking for any sores, any redness, any areas that don't look normal. Okay, good. Next thing, can I have you do a full circle with your head just like this? Perfect, good. I'm noting that you have full range of motion of your neck. So now I'm going to palpate your neck for your lymph nodes, any masses, and again, areas of tenderness. As always, please let me know if you experience any pain during this, and I will stop the exam. Okay? All right, I'm just feeling all underneath your chin here, down the sides, in front. Good. No tenderness with that? Perfect. So I'm now going to palpate your tracheal area, and let me know if you experience any discomfort, okay? Okay, good. Everything feels normal with that. Now I'm going to be able to palpate your thyroid gland. Normally, the thyroid gland is a little bit tricky to feel. So to do this, I'm going to ask you to take a couple sips of water. And as you drink, as you're swallowing that water, it's going to allow me to feel your thyroid gland a little bit easier. Does that make sense? Okay, let me go get that water. Okay, Mr. Timberlake, again, I'm just going to have you take a few sips of water. I'm going to be standing behind you so that I'm able to put my hands where I need them. As you're drinking that water, I'll be able to feel your thyroid gland, okay? Here's the water. Just going to stand behind you. Okay, and sip. Sip. Good. So as you were drinking, I noticed a natural rise and fall of your thyroid gland, which is perfect. That is normal. I'm going to place this water up here. Good. Now for the last part of our assessment, I'm going to auscultate and palpate your carotid arteries, which are right here in your neck. Excuse me. First, I'm going to palpate them, then I will auscultate them, okay? So to palpate them, I'm going to feel one side at a time. Again, if you feel any areas of tenderness, please let me know. Ready? Okay, I'm just going to palpate this side first. Okay. Good. Now we're going to do the other side. Good. Now before I listen to your carotid arteries, I'm just going to clean my stethoscope here. Also, to listen to your carotid arteries, I'm going to be using the bell of my stethoscope. This is going to allow me to be able to hear things better, okay? Good. I heard no breeze or thrills, which is all normal. So, Mr. Timberlake, this concludes our assessment today. So again, today, we did our head to neck. We went over scalp, hair, your cranium, all over your head, your cranial nerves. We did your eyes, nose, mouth, and ears. We inspected your sinuses and your neck and your throat area. Do you have any questions for me about anything we covered today? No? Okay. Everything looked great. I didn't find any abnormalities. Everything was normal. You appear to be in very good health. Perfect. If you do have any further questions or comments, please feel free to contact the doctor's office here. Great. You enjoy the rest of your day, Mr. Timberlake. Yes, thank you. You too.